Hey guys, it's Dr. Ivy Branin here of Simplicity Health Associates. I wanted to take some time to talk about some of the exciting cases that we've been working with. So we have a freshman in college. She came to see us because she had not had her period in about 6 months. Prior to her not getting her period, she actually had pretty irregular periods, and it wasn't that unusual for her to skip a few months. In fact, in her early teens, she was diagnosed with PCOS, polycystic ovarian syndrome, and actually had been on birth control pills to regulate her cycle. Also to note about this patient, she also had been diagnosed a few years back with SIBO, small intestinal bacterial overgrowth. She had completed a SIBO protocol with another doctor. So the other thing that we noted, because of the SIBO, she was on a pretty restrictive diet, and we're kind of like feeling that was not appropriate in this case. So one of the things that we recommended for her was actually to increase carbohydrate. And also the other thing, she was exercising a little bit too heavily than we would have liked, and so we also recommended for her to scale back. Now, we ordered a full hormonal panel for her. We also ordered some additional blood work to look at metabolic markers, to look at different nutrients. And then in addition to the lab work, we also recommended that she start seed cycling. One of the things that we love about seed cycling is that regardless of where the hormones end up when we do the testing, seed cycling always seems to kind of help to bring things into balance. If you're not that familiar with seed cycling, you can always check out our website. We have a couple articles on seed cycling. Anyway, so labs came back and she did not actually have PCOS. Actually, the labs indicated that she was suffering from hypothalamic amenorrhea. How do we know this? One, her estrogen was very low as a marker of estradiol. Also, her FSH and LH, that's follicular follicle stimulating hormone and luteinizing hormone, both were on the lower end. And then also DHEAS, which is more of a precursor hormone producing the adrenal glands, was low. So based on these findings, we then recommended, in addition to the cycling and the dietary changes, we recommended to take maca to support estrogen, and also black cohosh, but not throughout the whole cycle, just the first half. So we're happy to report that within a few months of starting the supplements and starting the changes, she had got her first period after not having a period for a long period of time. So these are cases that we love working with here at Simplicity Health Associates.